Hello dear students, how are you? I hope you all are doing well. So you're also enjoying the online lectures. So continuing with our online lectures, we are going to study heart. So we've already studied about pericardium and general basic features of heart. Today we are going to study about the interior as well as exterior of heart. So let's start studying the external features of heart. Everyone knows that heart has four chambers, an atrial above, and the position is such that not only they lie above, the atrial lie above, but they lie behind the ventricles. Okay. What are the various grooves or sulci which are present in the heart? The first groove I am going to discuss is the coronary sulcus, that is also known as atrioventricular groove. Between the atria and the ventricle is the coronary sulcus. Interatrial groove. This interatrial groove, that is a groove between the two atria. It is faintly visible, not very easily seen. Then is the interventricular groove. Interventricular groove, it is anterior and posterior. There are two interventricular groove, anterior as well as posterior interventricular grooves. We are going to see them. So this is the slide showing you the grooves and sulci. Let's have a look on the atrioventricular groove. Atrioventricular groove. Here lies the two ventricles, right as well as left, and the groove is interventricular groove. You can see over here, interventricular groove, the anterior interventricular groove or sulcus. Likewise, there is posterior interventricular groove. Posterior interventricular groove or sulcus. This is the posterior aspect of the heart. Now, what are the other features of heart? Heart has an apex, a base, that is also the posterior surface, then the surfaces. Surfaces are anterior, that is also known as sternocostal, inferior, also known as diaphragmatic, and left. And the borders are upper, lower, right, and left. So the various parts are apex, base, surfaces, and borders. Heart is just like a cone. Looks yummy to you? So heart has an apex and a base. Let's see the heart now. First of all, we'll just describe about the various features of the points we're talking about. Like apex. What is this apex? Apex of the heart is formed by left ventricle and it is located in fifth left intercostal space. The direction is downwards, forwards, and to the left. So apex is formed mainly by left ventricle. Left ventricle. Apex is formed by left ventricle. Base is formed by left atrium mainly, and in the left atrium is the opening of four pulmonary veins. Four pulmonary veins, right as well as left. And if you see the position of the base, it lies around the bodies of T5 to T8, that is 5th thoracic vertebra to the 8th thoracic vertebra in the lying posture. Let's see now. This is the apex of the heart and here is the base of the heart. This is the base of the heart, that is the left atrium, and here we can see the opening of the pulmonary veins, right as well as left, to right and to left pulmonary veins. What about the surfaces of heart? The heart has sternocostal surface, that is which is in relation to the sternum and the ribs, the anterior surface, and that is formed by right atrium and right ventricle. Right atrium and right ventricle forms sternocostal surface. Though left atrium and ventricle, they also participate in the formation of the sternocostal surface, but mainly right atrium and right ventricle form the anterior or the sternocostal surface. There is one term that is used by clinicians that is known as area of superficial cardiac dullness. Do you remember the cardiac notch in the left lung? There is the whole of the heart, most of the heart I would say, that is covered by the lungs, but there is one area that is uncovered of the heart, that is behind the cardiac notch. And that area, when percussion is done, that area feels dullness. There is dullness, and that is the area of superficial cardiac dullness. Then is the inferior or diaphragmatic surface. Inferior or diaphragmatic surface, that is formed by, on the left side, by the left ventricle, which forms about 2/3 part, and on the right side by right ventricle, which forms 1/3 part. So left ventricle part forms more of the diaphragmatic or the inferior surface, though both the ventricles form the diaphragmatic or inferior surface of the heart. Then the left surface. Left surface is formed mainly by the left ventricle and left auricle. Let's see now. We talked about the sternocostal surface. So sternocostal surface is formed by right atrium and ventricle mainly. Also left ventricle and left atrium participate, but main is by the right atrium and right ventricle. So this is the area of the cardiac dullness. Here is the cardiac notch of the left lung, the area which is uncovered by the lung. So the two surfaces, let's revise once again. This is forms the posterior surface or base, and here lies the diaphragmatic surface or the inferior surface. There is one more term you should know, that is the crux of the heart. Now crux of the heart is the point where posterior interventricular sulcus meets the coronary sulcus. That is the crux of the heart. Okay. So here lies the left surface. So the left surface is formed mostly by the left ventricle and at the upper end by the left auricle. So just imagine this is the heart. So what are the various surfaces? Anterior surface, posterior to that would be the posterior surface or the base, right surface, left surface, and the inferior or the diaphragmatic surface of the heart. I hope the surfaces are clear to you. Now we will study about the borders of the heart. What are the borders of the heart? The first is upper border. Now upper border is slightly oblique and it is formed mainly by the left atrium. Right atrium also participates, but left atrium mainly participates in the formation of the upper border of the heart. While right border is formed by the right atrium and it extends from superior vena cava to inferior vena cava, and it is more or less vertical. So right border by right atrium, upper border by left atrium mainly. Now inferior border is formed by right ventricle mainly, but near the apex, left ventricle also form the inferior border. But where? Near the apex. And the left border is formed by the left ventricle, also by the left auricle. So, there are four borders: upper border, right border, inferior border, and left border. We can have a look at the slide and we can see the borders. The borders are, yes, this is the right border, the inferior border, which is formed mainly by the right ventricle. Near the apex, it is formed by the left ventricle. Here lies the left border and here lies the upper border or the superior border. I hope borders and surfaces are clear. Now there is one more thing, that is the sinuses of the heart. Now there are two sinuses, transverse sinus and the oblique sinus. And these are the lines of reflection between visceral and parietal pericardium. The visceral and parietal pericardium, the reflections of these pericardium forms the two sinuses, transverse sinus and the oblique sinus. And why should we know them? Because they have some clinical relevance. Like for example, for the transverse sinus, during cardiac surgery, this sinus allows the surgeon to identify, to isolate the pulmonary trunk and also the ascending aorta, and then can apply a temporary ligature or a clamp. This is required for performing surgeries like coronary artery bypass surgeries. So, the knowledge of transverse and oblique sinus is a must, and these are nothing just the reflections, lines of reflections between visceral and the parietal pericardium. We can have a look. This is the transverse sinus. The transverse sinus is, what is the transverse sinus? It is nothing, it is just a horizontal gap between the arterial ends of the heart in front and venous ends behind. Please listen carefully. This is not at all difficult. Transverse sinus, in front of that, what are the features of transverse sinus? Anteriorly is the ascending aorta and the pulmonary trunk, and posteriorly is the superior vena cava. So, this means that there is a gap between arterial end and the venous end. Arterial end is present anteriorly, venous end is present posteriorly. No worries. If we insert a finger in the transverse sinus, so anteriorly is the pulmonary trunk and the aorta, ascending aorta, arch of the aorta, and posteriorly is the superior vena cava. So the finger is in the transverse sinus. I hope it's clear. Now, there is one more sinus, that is the oblique pericardial sinus. It is the sinus which has various walls. Like anteriorly is the left atrium. Can you make out this is the left atrium into which the four pulmonary vessels are opening, arteries are opening. So pulmonary veins, to right and to left. So anteriorly is the left atrium, posteriorly is the pericardium. On the right side is the two pulmonary veins of the right side and two pulmonary veins of the left side. One more slide, we can have a look. So this is the oblique sinus. Here lies the which sinus? The transverse sinus. It is present transversely, and here lies the oblique sinus between the two pulmonary veins. This is the oblique sinus. And no, sinuses are nothing, these are the reflections of the visceral and parietal pericardium of the serous pericardium. Done? Yes. Now, yes, interior of the heart. We have already studied the physical features. Now we are going to study the interior, the inside of the heart, the inside story out. Yes, we're going to study about the right atrium first. The right atrium is divided into three parts. Smooth posterior part, also known as sinus venosus, rough anterior part or pectinate part, which includes auricle, and the interatrial septum. Let's revise once again, repeat once again. Smooth posterior part or the sinus venosus, rough anterior part or the pectinate part, which includes the auricle also, and there is one more important feature of the rough anterior part, that is known as musculus pectinati. Musculus pectinati, these are the transverse muscular ridges. Transverse muscular ridges, and they resemble teeth of the comb. Teeth of the comb. Every day you comb. So whenever you see the teeth of the comb, remember the musculus pectinati. They form the reticular network. And the interatrial septum. Interatrial means the septum. Interatrial septum means the septum between the two atria. It shows a depression known as fossa ovalis, and sometimes foramen ovale. We'll study these parts. Now we are inside the right atrium. Right atrium. So we talked about the smooth posterior part, the smooth posterior part, the rough anterior part, and in the interatrial septum is the fossa ovalis. Oval fossa, that is fossa ovalis. Let's see once again. So what we can see, the smooth posterior part, rough anterior part, and can you see the muscular ridges over here like the teeth of the comb? So these are musculi pectinati. Here lies the foramen ovale, not foramen ovale here. This is the fossa ovalis, and foramen ovale is present occasionally between the right atrium and the right ventricle. You can see one cusp, that is known as tricuspid wall. Tricuspid wall between the right atrium and the right ventricle. We are not seeing the right ventricle, just seeing the cusp, that is a tricuspid cusp or the valve. Now in the smooth part, what are the features of the smooth part? It shows openings, the various openings in the right ventricle in the smooth part are superior vena cava, inferior vena cava, which is guarded by the valve of inferior vena cava or the eustachian valve, and is the coronary sinus. Now coronary sinus is present between the opening of inferior vena cava and the right atrioventricular orifice. Then there is presence of venae cordis minime. These are the small numerous veins which are present in the walls of all the chambers. Okay. Also is there presence of intervenous tubercle of lower, that is below the opening of the superior vena cava. It is not seen in human beings. Mostly it is distinct, it is in the hearts of quadrupeds but not in humans. And it lies where? It lies above the fossa ovalis. So if we talk about the various openings, the main openings in the smooth part are superior vena cava, inferior vena cava, and the coronary sinus. The venae cordis minime, they are present in all the walls. These are small veins. Let's have a look now. What did we talk about? The opening of the major vessels. Superior vena cava, inferior vena cava, the coronary sinus. Here's the valve of the coronary sinus. This is between the inferior vena cava and the tricuspid area, that is in the opening of the right ventricle. These are the main openings in the smooth part of the right atrium. Can you see these veins, small openings? These are the venae caudes minime, which are present in all the chambers of the heart. So this side is also showing you the opening of the right atrium, the coronary sinus opening, and the tricuspid wall. Here is the right ventricle. Now, after studying the smooth part, let's study about the interatrial septum. The features of the interatrial septum are there is presence of fossa ovalis, that is a shallow saucer-shaped depression in the right atrium at the level of the interatrial septum. And this is the site for embryonic septum primum. We will study in the class of embryology when we study the heart. Then you can learn about this more. So fossa ovalis is nothing, it is a site of embryonic septum primum. And the margin of this fossa ovalis is prominent, and that is known as annulus ovalis or limbus fossa ovalis. Annulus ovalis or limbus fossa ovalis, it is a prominent margin of the fossa ovalis. Now sometimes there is a presence of foramen ovale. Normally it is occluded after birth, but sometimes it may possess foramen ovale. Let's have a look now. This is the fossa ovalis, and here is the prominent margin, and that is known as the limbus of fossa ovalis. The prominent margin. Now we have to study about rough anterior part or the pectinate part. What are the features? The line of union between the right atrium and the right auricle. The line of union between the right atrium and the right auricle is present on the interior of the atrium in the form of a crest, and this crest is vertical, and that is known as crista terminalis. Crista terminalis. Now this crista terminalis is generally a smooth surfaced, thick portion of the heart muscle, and it is crescent in shape at the opening into the right auricle. Means this crista terminalis is the point, thickened point, thickened portion of the heart muscle between right atrium and right auricle. And on the outside, on the external aspect of this crista terminalis, if you want to see the point where this crista terminalis is formed, that point is known as sulcus terminalis. So externally is the sulcus terminalis, internally at the same point is the crista terminalis. And this is the point which provides the origin for all the pectinate muscles. Let's see now. This is the crista terminalis. We've taken out the wall from this side, and we can see the crista terminalis. And this is the point from which the musculi pectinati have emerged. Okay. Let's see the pectinate muscles, and let's see the crista terminalis. Crista terminalis and the pectinate muscles. That is, we are talking about the rough anterior part of the right atrium. Now this musculi pectinati or pectinate muscles, what are these? These are actually the parallel ridges in the walls of the atria of the heart. We already discussed that they resemble the teeth of the comb, and hence the name. In the left atrium, muscular pectinati are also present, but they are fewer and smaller as compared to the right auricle or right atrium. And according to some sources, the main function, the use of muscular pectinati is that it increases the power of contraction. It increases the power of a contraction without increasing the heart mass substantially. So these are the pectinate muscles, the crista terminalis, the fossa ovalis. Above is the opening of superior vena cava, below is the opening for the inferior vena cava. Here lies the coronary sinus. So let's move on to right ventricle. Now right ventricle, what does it form? First of all, let's study about the various features. That the surface is rounded and convex and forms the larger part of sternocostal surface of the heart. And the undersurface of the right ventricle is flattened and it rests upon diaphragm. And it also forms a small part of the diaphragmatic surface of the heart. Here lies the right ventricle. And in this side, can you see some conical projection that is known as conus arteriosus, and that is continuing with pulmonary trunk. Right ventricle, right atrium, left ventricle, left atrium. And if we see the right ventricle, there is some projection that is continuing to form the pulmonary trunk, and this projection is conus arteriosus. Conus arteriosus. Let's see now. Now, right ventricle, the upper and its left angle forms a conical pouch. We have just seen that is known as conus arteriosus, from which the pulmonary artery arises. Now, if we compare to the walls of the right and left ventricle, so which wall is thicker, right or left? Yes, left ventricle wall is thicker as compared to right. Right is thickest only at the base and it is thin towards the apex. So the main thing is, what I want to tell you over here is that the difference in the walls of the right and left ventricle is based on the function. Left ventricular wall has to perform more task. Okay. Now let's see right ventricle. What we can see over here, the conus arteriosus. The conus arteriosus, the projection from where the pulmonary trunk is going to arise, and these are the three valves of the pulmonary trunk. These are known as pulmonary valves: anterior, right and left. What else we can see in the right ventricle? The cusps, the tricuspid valve. That is a valve which is present between the right atrium and the right ventricle. It has anterior cusp, which is related with the septum, is the septal cusp, and here lies the posterior cusp. Three cusps, so tricuspid valve. Now, if we study the interior of the right ventricle, it has two main parts: inflowing part and the outflowing part. Inflowing part is rough because of the presence of muscular ridges. There is a new term now that is known as trabecular carnii. Trabecular carnii. And the outflowing part, that is known as infundibulum, it is smooth. Now this outflowing part, which is smooth, forms an upper conical part from which the pulmonary trunk arises. Let's see what do we mean by that. Right atrium, right ventricle. Okay. Right ventricle has rough inflowing part and smooth outflowing part. And rough is because of the presence of trabecular carnii. And there is one green line, this is known as supraventricular crest. It is nothing, it is just a muscular ridge which separates the rough and the smooth part. Supraventricular crest. Now this term trabecular carnii They are also known as columnae carnii or meaty ridges. Meaty ridges. These are nothing, these are the rounded or irregular muscular columns which project from the inner surfaces of the right and left ventricles of the heart. Please do not confuse it with the pectinate muscles. Pectinate muscles are different, which are present in the right atrium, okay, and in the left atrium, left auricle, I would say. But these are different as compared to the trabecular carnea, which are present in the right and left ventricles. Let's see. These are the trabecular carnea. You can see this. These are the ridges. These are the trabecular carnea. Now there are three kinds. There are three types: trabecular carnea, ridges, bridges, and papillary muscles. Ridges, bridges, and papillary muscles. What are the ridges? Ridges are the mere elevations. They are attached along the entire length on one side, and they just form the prominent ridges. Okay. Bridges. What are bridges? You have seen a bridge. What are the features of a bridge? The two ends are fixed and it is hanging in between. Yes. So the bridges are that part of the trabecular carnea which are fixed at their extremities, but they are free in the middle. They are free in the middle. And what are the papillary muscles? These are the muscles like pillars. They are continuous by their bases with the wall of the ventricle, and their apices give origin to the thread-like structures which are known as chordae tendineae. Chordae tendineae, which are attached to the bicuspid as well as tricuspid valve. We'll see the diagram first, it will be more clear to you. Let's see first of all, what do we mean by the three terms we just used? The ridges. Ridges are the mere elevations. Bridges are where are these elevations which are fixed at two ends, but they are free in the middle. And what are the papillary muscles? Papillary muscles are again like ridges, but here one more addition is that they are attached with the thread-like structures known as chordae tendineae, which are attached with the cusps of the bicuspid or tricuspid valve. Okay. Now what are the function? What's the function of this trabecular carnea? Now this main function is to prevent suction that would occur with if the surface is flat. What would happen? When the blood flows from the atrium to the ventricle, if the surface is flat, then suction can be there, na? So that if the surface is smooth, and what would it result in? It would impair the heart's ability to pump efficiently. So these irregularities or the trabecular carnea's different types, they prevent the backflow of blood from ventricles into the atria. You can just have a look on the trabecular carnea which are present in the right ventricle. Different types are there. Let's see now the papillary muscles. The papillary muscles, we have studied about the ridges and bridges. The papillary muscles, there are three types: anterior, posterior, and septal. There is one more trabecula that is known as septomarginal trabecula. Yes, septomarginal trabecula, that is also known as moderator band. That is a muscular band of the heart tissue that is present in the right ventricle, and the main importance or relevance of this moderator band or septomarginal trabecula is that it is often used by obstetricians and radiologists to identify the right ventricle in prenatal, before birth, prenatal ultrasound. Okay, let's study about the moderator band. Over here we can see the moderator band. Now we just have a look on the cusps and the valve, and these are the papillary muscles. These are the papillary muscles. In the tricuspid wall there are three cusps, and the muscles are anterior papillary muscle, the posterior papillary muscle, and here lies the septal papillary muscle. So 3 papillary muscles for 3 cusps. That is a tricuspid valve. Now these papillary muscles, yes, we just discussed that these, what are the main function of these papillary muscles? First of all, you should know their location. They are in the ventricles and they are attached to the respective cusps, walls, I would say. That is, on the left side is the mitral valve, on the right side is the tricuspid wall. Their main function is to prevent inversion or prolapse of these valves. Let's see how. Can you see this diagram? This is open, this is closed. Here lies the papillary muscles which are relaxed, and you can see the relaxed chordae tendineae. When this muscle contract, when the papillary muscles contract, the chordae tendineae become taut. Initially it was open, and when they just pull on, the cusps close. So we don't want the backflow of blood from ventricle to atria. Once a blood enters from atrium to ventricle, the backflow shouldn't be there. So this is the role of the papillary muscles with the help of chordae tendineae. Is this clear to you? Let's proceed now. Now what are the orifices, the openings in the right ventricle? Tricuspid orifice, which is guarded by tricuspid valve, and the pulmonary orifice, that is guarded by pulmonary valve. So between the right atrium and the right ventricle is the tricuspid valve. So this is one opening. Another is with the pulmonary valve is there. So from the pulmonary trunk. So 2 openings in the right ventricle. Now what is interventricular septum? Interventricular septum, also known as ventricular septum, if you study the embryology, it develops from the septum inferius. It is also abbreviated as IVS. It is a stout wall which separates the lower chambers, that is from the one ventricle to the from the right ventricle to the another. It separates. This interventricular septum, its margins correspond with the anterior and posterior interventricular grooves. Here lies the interventricular septum. We have already studied about the right atrium and the ventricle. Now we are going to study about the left atrium. Okay, so stay with me. Left atrium. Left atrium is one of the 4 chambers in the human heart, and it receives oxygenated blood from pulmonary veins, and it has to pump where? Into the left ventricle. Why? Which valve? The mitral valve. This everyone knows. Left atrium. This is the left atrium. The 4 pulmonary veins, right and left. What are the features? The features of the left atrium is that it forms the oblique sinus. Remember the oblique sinus of the pericardium? Yes. Anterior wall of this atrium is formed by the interatrial septum, and the 2 pulmonary veins open into the atrium on each side of the posterior wall. The wall is smooth, and there is one more fossa. Remember we talked about the fossa valis in the right atrium, and corresponding to that there is one more fossa in the left atrium, and that is known as fossa lunata. Let's have a look. So we are in the we are in the left atrium, and here lies the fossa lunata. Same as that of the fossa valis we studied in the right atrium. Here lies the bicuspid or the mitral valve. Now the left ventricle. Left ventricle is shorter and is more conical in shape as compared to the right ventricle. and it forms a small part of the sternocostal surface, and yes, a considerable part of the diaphragmatic surface of the heart. Also forms very important part, that is the apex of the heart. Left ventricle forms the apex of the heart. So here is the left ventricle, the apex. If we study the interior features of the left ventricle, it also has the rough part or the trabecular carnii, and the upper part is smooth, that is also known as aortic vestibule, which gives rise to ascending aorta. So there are two orifices here again, bicuspid valve or mitral or left atrioventricular opening, and the aortic orifice that is guarded by the aortic valve. And here the papillary muscles are two, anterior and posterior. Anterior and posterior. Here lies the left ventricle. You can see the two cusps, two valves. This is known as a mitral valve. The features of the ventricles are the same. Difference is in that they are less and valve is two cusped. So the openings are two. Between the left atrium and the left ventricle is the mitral. These are mitral valve is there. One opening, another is with the aortic valve is here. So it is continuing with the aorta. Origin of aorta takes place from here. Now the walls of the heart, yes, human heart walls are remarkable structures. They are very thin, like a tissue paper. So they are very thin membranes and they are attached to the heart wall. And they work constantly. They open and close to regulate blood flow. And that causes the sound of a heartbeat. See the walls? Here lies the myocardium, the tricuspid wall, which is present between the right atrium and the ventricle. Here lies the mitral valve in the left ventricle, atrium between the left atrium and the ventricle, the aortic valve and the pulmonary valve. These are sublinar valves. So heart has how many valves? 4 valves, mitral valve and tricuspid valve, which are responsible for controlling the blood flow from atria to the ventricles. The aortic valve and the pulmonary valves, which are also known as seminal valves, and they are responsible for controlling blood flow out of the ventricles. So you can see beautifully the cusps, the mitral and the tricuspid. This is the way they work constantly. Now, little bit about mitral valve. This is bicuspid valve and its name is derived from the resemblance to a bishop's mitre, a type of hat. It allows the blood to flow from the left atrium into the left ventricle, and it has 2 cusps. A common complication of one disease that is known as rheumatic fever, there is thickening as well as stenosis of the mitral valve. So here lies the mitral valve, anterior cusp and the posterior leaflet or cusp. It's bicuspid. Tricuspid valve, yes, 3-flapped valve, and it is between the right atrium and the right ventricle. It has 3 cusps. So you can see the cusps of the tricuspid valve, and alongside with that are the chordae tendineae. These are the thread-like structures, and here lies the papillary muscle. So the various valve we studied: the bicuspid valve, the tricuspid valve, and the semilunar walls, that is a pulmonary as well as aortic. Semilunar walls, this you should also know. There are two semilunar walls. Aortic wall first. It lies between the left ventricle and the aorta. It has three cusps, and each cusp is directly attached to the vessel wall, and the cusp form the small pockets. The center part is known as nodule, and the line which extends from the nodule is known as the lunule. Nodule, lunule. Just have a look, no worries. So we talked about the aortic wall. The center point is known as the nodule, and which extends from the nodule is the lunule. Likewise, also for the pulmonary wall, there are three number. The center point is known as the nodule, and extending to that is the lunule. Pulmonary as well as aortic valves. So you can see the aortic semilunar valves. Finally, last and not the least is the applied aspect of the heart. There are certain places to auscultate the heart, and routine places which are used for auscultating are right and left sternal border as well as at the apex. These are the places which are used for auscultating the functioning of heart. Then here lies the chest X-ray. Chest X-ray, you can see the heart over here. This is the normal male, chest X-ray of the normal male. This is the chest X-ray of the normal female. How can you distinguish between the X-ray of the from by the male or female chest X-ray? By the presence of the breast in the case of females. And this is the lateral view of the chest X-ray. Yes, this is the pacemaker, the artificial cardiac pacemaker. The main function is to regulate the electrical conduction system of heart. Thank you so much, dear students, for your patience. Thank you and have a nice day.